Health insurance is a type of insurance that covers the cost of an individual's medical and surgical expenses. It helps to mitigate the financial burden of paying for medical expenses out of pocket. There are various types of health insurance policies available in the market, each with different levels of coverage and costs. Here are some things to consider when choosing a health insurance policy. Coverage. Consider what type of medical expenses you want your policy to cover, such as hospitalization, doctor's visits, prescription drugs, or alternative treatments. Deductibles. This is the amount you have to pay out of pocket before your insurance starts covering the expenses. Premiums. This is the amount you have to pay regularly, either monthly or annually, to keep your insurance policy active. Consider your budget and the coverage you need to determine the right premium for you. Network of providers. Make sure your policy has a good network of medical providers, including hospitals, doctors, and clinics, so that you can access the care you need. Pre-existing conditions. Consider whether your policy covers pre-existing medical conditions and what the waiting period is for coverage. Lifetime maximum. This is the maximum amount that your insurance policy will pay out over the course of your life. Make sure this amount is sufficient to cover your medical expenses. Additional benefits. Some policies may offer additional benefits, such as coverage for maternity care, mental health, or alternative treatments. Consider which of these benefits are important to you and if they are included in the policy you are considering. It's important to do research and compare different health insurance policies to find the one that best fits your needs and budget. Additionally, you may want to consult with a financial advisor or insurance agent to help you choose the right policy.